Manshadi joining us from Manshadi Pharmacy. Thanks for joining us, Misa.
Thank you for having me.
Always a pleasure to have you here. Today we are talking about, we do specific topics with you usually on these segments, and today it's all about acne, which is something that we know impacts a lot of people, a skin condition that a lot of people deal with. Some severe, some not so severe. But what can you tell us about acne? How prevalent is it?
Yes, it is quite prevalent. 20% of Canadian population develop acne. That means 5 million people have acne. Wow. I have 4 kids, and 3 of them are going through the puberty and teenage years. And I can see the emotional impact that can bring about when they have developed acne. Especially young adult girls can affect their confidence and can have a great emotional impact on them. And 95% of the teens can develop acne. So it's a huge problem which can cause emotional distress and also scarring. So we are here to talk about it and telling people that there is treatment available and they should seek treatment as soon as possible.
Yeah, absolutely. We have some points that maybe we can put up on the screen for people here. So acne, yes. So as you mentioned, affecting 5 million Canadians. Tell us a little bit, Misa, about what it is exactly. We see here it's found on mostly the face, neck, chest, and back.
Correct. So usually it starts around puberty, and the hormones start to surge, especially testosterone, and we will see this oil glands producing more oil, and the dead skin cells doesn't shed off as often. So the combination of this production of oil, increase in production of oil and dead skin can clog the pores and can develop acne. And in the beginning, usually is a blackheads or whiteheads, and then can go further in action. So we see it usually during the puberty when there is a hormonal fluctuation and surge.
But also a few other causes as well as...
Absolutely, they can be medications, you know, prednisone, anabolic steroids, sometimes birth control pills, lithium. Those are, when it comes to medication, they are cystic ovary syndrome, polycystic ovary syndrome that can cause, the conditions can cause acne, and different, when there is a different hormonal problems, both in young adult and even in older adults.
Right, and I know there's lots of treatment for acne, as you're mentioning. That's what we want to tell people, sort of how to treat your acne. Washing and moisturizing, that seems like the obvious one, but can you overdo it too?
Absolutely. If a lot of people, they think dirt is causing acne, which is not true, and they do start to wash it more than often. They should only wash it maybe twice a day, and they should wash it with the products that they are not abrasive.
Right, you dry out your skin a lot.
Yeah, they dries the skin a lot, and so things that oily products should be avoided, and any product that has fragrance or petroleum should be avoided for washing, and twice a day will be sufficient enough. And then they can use moisturizer. They can even use cosmetic if they want to, as long as it's a good cosmetic and doesn't cause plugging of the pores, and so it can cause the problem worse. They are, for a mild acne, there is over-the-counter medication available. One is benzoyl peroxide or salicylic acid, which we can use. However, after 6 to 8 weeks, If there is not improvement, we should immediately seek medical advice.
Because as you mentioned, that you don't want to have that scarring if you don't have to. Right?
Exactly, and it's 95% of people when they have acne, they will have some sort of scarring, and we want to prevent that. So seek medical attention early on. See your pharmacist, see your physician, and seek help. And know that there's a lot of people have this condition. And
not just teenagers.
Not just teenagers, adults, you know, that's also have acne problems.
Well, thank you so much, Misa.
Thank you.
And Manshadi Pharmacy, 2 locations. They have, of course, the North Shore location and the South Shore. The information's there on the screen. And, of course, you have those over-the-counter treatments available to those that might need them. Thank you so much, Misa.
Thank you for having me.
Absolutely. We'll be right back. Stay with us on Midday.